My name is Lucy Roberts. In this video, we're going to look at how your feet can be the cause of sciatica, the reasons why your feet can be the cause of sciatica, and what we can do to change that. Sciatica has been the most common condition that I have treated over my 20 years of being a sports therapist. In this time, the first thing I do when I see a client is I look at their feet. I say, take your shoes and socks off, let's get down to it, walk up and down, let me see if your ankles are rolling in and how your feet are actually sitting on the floor. It is a huge telltale of what's happening. It's the foundation to the whole structure of your body. If you think of the body like a building has a foundation. If that foundation starts to change over time, then the whole building is going to start to have problems because the foundation is moving. And yes, we walk on our feet and they're constantly moving. But if the actual structure of how those feet are supporting us is changing, then that is going to have a domino effect up through the body into your back and notably your legs, your buttocks and the lower back, and can be a huge cause of sciatica. Newsflash, the body is a really inefficient design. If you think about your body, the heaviest part of it is your head, and that's right at the top. We spend our lives vertical, literally stacked on top of each other, and the smallest surface area comes from the foundation, your feet. The smallest part of your body, which is going to hold the rest of you up for the entirety of your life. So let's look at why the feet cause sciatica. As we grow and during our lifetimes, we change. We change, our weight changes, the load on top of our feet changes, the amount of time we spend upright on our feet means that the feet are under constant pressure. Our jobs change. Sometimes we sit more, sometimes we're exercising. We go from having bouts of exercise to then sitting, and then sitting to more bouts of exercise. We do different things. All of a sudden the summer holidays will come, we'll go and climb a mountain, or we'll walk more, we'll go on holiday. We're in flip-flops, the flattest thing you can wear. Your body's adapting to this all the time. But newsflash, the feet will start to change through this pressure. One of the most common things that happens to the feet is the arches start to lower, and as they lower, the ankles start to roll in. And you may not notice this for many, many years. The change in your feet can happen really gradually. Often a client will say to me, well, there's nothing wrong with my feet. My feet have been great. I've been exercising all my life. I'm fit, I'm healthy. Why have I got sciatica? And when I look at their feet and I point out what's happening to their feet, they say, oh, yes, I can see how my foot is lowering. The arches are lowering. And as I walk and I look at myself in a mirror barefoot, I can see my ankles slightly rolling in. As the arches start to roll in, pressure comes in the side of the calf. So imagine my wrist, you've got an ankle rolling in slightly. Okay, this isn't a great example, but your ankles are rolling in. The counterbalance is going to be on the outside of the calf muscle at the side and the back, trying to pull that ankle back. And then you get a domino effect where this pressure here comes to the inside of the knee, where this is trying to counterbalance the pressure that this is pulling, and then you've got a whole stressful situation happening from the inside of the knee up to the outside of the hip, where you get this inner, middle and outer hip tension, similarly trying to counterbalance that. And over time this just tightens and tightens. We get muscle fibers that twist up and knot up, and for a long time you may never notice anything, and then all of a sudden it gets too much and the pain starts to set in. So imagining my arm again as a leg, you've got the ankle rolling in, you've got the calf muscle tightening, you've got the inside of the knee which is tightening, you've got the hip tightening, and then the hip then travels round, connects into the buttocks start to twist and they start to tighten, and bingo, the sciatic nerve gently starts to be pinched. And that's when the extreme pain comes from sciatica. The pain can resonate up through the lower back, and then it's hell. Footwear is a common reason as well why the feet change. Anybody who's worn high heels a lot during their life and then suddenly they decide to take them off and go, do you know what, I'm done with high heels. Maybe I'll wear them every now and then on special occasions, but ultimately I am coming down. Then everything changes. The legs have got to adapt again, the calves have got to adapt again, their feet have got to adapt again on this whole new way of working. And people say to me, yeah, well, I don't wear high heels anymore. How can I have sciatica from that? because your legs were used to being in high heels, and now the high heels have gone and they're now lowered, and now they've got to adapt again. Sometimes I have clients, manual labouring clients, builders, people who are on their feet a lot, or people who weight train a lot. They're carrying heavy loads, and carrying heavy loads over time puts immense pressure on the feet, and the feet start to gently lower. This is the same effect. A repetitive sport. If you've been doing a sport like running for many years, that pounding on the pavement is going to gently start to lower your arches, and as the arches lower, the ankles roll in. Often we don't change our trainers regularly enough, and if we don't change our trainers regularly enough and the support is going, then that too is going to accentuate the rolling in of the ankles, which puts the pressure on the rest of the legs. So the real answer is how do we change this? How do we combat this? Well, it all comes down to footwear and how your feet are during the day. Many people spend a lot of time either in slippers, flip-flops, and very unsupportive footwear. So the big thing is we need to change that. There's also other things we can do. We can head to Amazon and we can buy some very cost-effective insoles which are just going to start supporting the arches and start to alleviate this. I have some recommended go-to insoles that I prefer. They're ones that don't take up too much room in your shoes, but they can be very effective to start with. If you want to know what these insoles are and where we get them from, there's a link in the bio. They're very cost-effective. Please check it out. Also, if you want to look at footwear, flip-flops, things like that which you love to be in around the house but you need some more arch support, there's a link in the bio for some companies that I can recommend which do some really good footwear for that. Okay, so the other things we can do which are very important, and that is to keep our bodies supple. And to keep our bodies supple, we need to stretch regularly. If you are suffering from signs of sciatica or extreme sciatica, it's time to start pulling these muscles, tendons and fibers out and combating the tightness and the twisting and the knotting up of these fibers which are causing everything to change. So if you are interested in a good stretch routine, please check out our video here. The other thing that is super good is buying yourself a really good massage gun. Okay, there's many massage guns on the market, and I have got my top 3 favorites, from a budget to a good to my best range. Well, recommendations, they're not mine, but they are ones that I recommend to my clients. Please check out that link as well in the bio. It will take you straight to why and how and where to get these massage guns from. Very quick, very easy. And essentially using a massage gun is the best option for literally getting into those muscles and releasing the pressure quickly. It really can be a game changer. If you combine stretching and deep tissue work with a massage gun and you use it in the right places, in the correct way, on the correct speed, in the correct speed of the actual gun and the rotation, but also the speed in how you are working the gun and the pressure used, then you are going to make significant changes. If you want to learn how to use a massage gun correctly, please follow my instructions in the book Simple Steps to Stop Sciatica and Back Pain. It is a comprehensive guide. It will show you why your feet can be the cause of sciatica, other reasons why you can be having sciatica, from the knees to the hips to many different things, posture, how to combat those issues, and it will show you how to use a massage gun correctly so you get the best results. It really does make a huge difference. Use these tools correctly and all of a sudden they're your best friend, and they really are the difference between you living a very pain-free life and a comfortable life and being active and healthy, or to struggle and to not have those good results. If you're interested, please check out the link below for our book that will give you all the advice that you need. Do not wait weeks or months to get the help that you need by waiting for appointments from doctors and referrals to different departments to physios that will give you the minimum of what you need. There is more comprehensive help that you can do yourself at home. And lastly but not least, if you have found this information helpful and informative, please can you like and subscribe. We are a new channel here at PainfreeTribe, and we're going to be covering lots of different conditions in the future, bringing you updates, better practices, simple hacks that we come across, and general health tips. Our aim is to bring you really useful professional help straight into your home so that you can start taking control of your own health and really making a super difference. We'll see you very soon.